Hello everyone. In this session, we are going to cover an important topic that is osteomyelitis. In your exam, you get a long question as well as short question on one of the two type of osteomyelitis, that is either pyogenic osteomyelitis or tubercular osteomyelitis. So let's start it. Here you can see we are starting the topic that is osteomyelitis, pyogenic and tubercular. So this is the overview. These are the headings under which we are going to frame our answer and we are going to discuss the session. So first of all, I will let you know the definition of osteomyelitis. What do you mean by osteomyelitis? Then we will see the classification. In the classification, we will see there are two types of osteomyelitis, pyogenic osteomyelitis and tubercular osteomyelitis. And we will describe each of them under a fixed set of heading. Not only this, we will make a comparative table also between them in the end. So I will let you know the introduction for each of them, then the etiology, roots, sites, pathogenesis, microscopy, clinical features and complications for each of them. So let's start them one by one. So first of all, let me know what do you mean by osteomyelitis. Now see the definition, the spelling osteomyelitis, itis. Itis in pathology is inflammation of that particular tissue. For example, tonsillitis is the inflammation of the tonsil, pneumonitis, inflammation of the lung, meningitis, appendicitis, bronchitis, rhinitis. In the same way, osteomyelitis. So it is the inflammation of osteo. Osteo means bone and my is indicating bone marrow. So it is the inflammation of bone and bone marrow, that is osteomyelitis. Now coming on the classification, there are two types of osteomyelitis, pyogenic osteomyelitis and tubercular osteomyelitis. So we will see the details of both of them under a fixed set of heading. Let's start with the first one. The first one is the pyogenic osteomyelitis. So in the introduction, you have to write down the meaning of the pyogenic. What do you mean by the term pyogenic? Pyogenic means pus producing bacteria. So it is caused by the bacteria which produce pus inside the bone. So it is a suppurative. The meaning of the suppurative is also pus. So pyogenic, suppurative, it is a pus forming infection. So here in the diagram also, in the video also, you can see these are the bacteria which are entering inside the bone and bone marrow, and after entering inside bone and bone marrow, they are producing pus inside the bone and bone marrow. That is pyogenic osteomyelitis. So that is the introduction. Now in the etiology, you have to name the bacteria. Which bacteria is causing this most commonly? So most commonly, it is Staphylococcus aureus. Most common bacteria which causes osteomyelitis is Staph aureus, but there are other organisms also depending on the category. For example, in neonatal period, it can be Haemophilus influenzae or group B streptococcus. In genitourinary tract infection or IV drug users, E. coli can cause so. In patients with sickle cell anemia, Salmonella can cause so. And in surgery or open fracture, it can be mixed bacterial infection. So if you want to learn the categories, it's good. If you can't learn that, it's very okay. If you are writing the most common cause of osteomyelitis, you are going to get good marks. Okay. So write down the definition. In the etiology, write down the most common cause of pyogenic osteomyelitis is Staph aureus. Others, you can enumerate just the names, okay, if you wish. Now, this is important for MCQ purpose. They can ask you that in Salmonella, which is the bacteria, in open fracture, which is the bacteria. But you can learn them, okay. Now, coming on the roots. Now, the question arises that this is the bacteria. It is entering inside the bone and causing osteomyelitis. How the bacteria enters inside the bone? What is the root? How does bacteria enters inside the bone? So, there are three roots. What are the three roots? Number one, it is hematogenous root. Hematogenous means blood root. What do you mean by hematogenous? Hematogenous means blood root. So you know, whenever the bacteria is present in the blood, that is sepsis is there. There is infection in any part of the body, and via that the bacteria enters the blood. Now blood is going everywhere. Blood is going inside the bone also, bone marrow also. So via blood they can enter. So it can be due to minor injury to the skin, to the mucosa. It can be IV drug users. So whenever there is a bacteria in the blood, it can directly enter inside the bone. Number one. Number two, direct implantation by open surgery, penetrating wounds, open fracture. Now imagine this person was driving a motorcycle and he got a road traffic accident, unfortunately. So he got an open fracture. So the wound is contaminated with the soil, and soil contained the bacteria, and it was just dirty soil, and the open wound directly contaminated with the bacteria, and bacteria can directly go inside the bone without involving the blood. So that can be the direct implantation. Number two. Number three, from the adjacent site. The best example is the diabetic foot. You know, in diabetes, the sensations are less in the foot sometimes. That is known as diabetic neuropathy. So in diabetes, in chronic diabetes,